It's been a while since we had a virtual town hall, and with the community opening up, I thought now would be a good time to cover a few things. But I want to start by acknowledging everyone's efforts over the past 16 months. It has been a challenging time for all, but I am hopeful that we will get back to something approaching normal over the next few weeks and months. However, as we have learned throughout the past while, we need to be flexible. We need to be nimble. We need to be able to change or pivot should circumstances dictate. But to the reasons for the town hall. Number one, COVID screening. As you're aware, we introduced a QR code-based COVID screening application. Use of this tool has increased since its introduction, so thank you for that. It's important to note that COVID screening upon entry into the workplace is a mandatory requirement provincially. Indeed, you can be fined by the Ministry of Labour if they cannot find evidence that you completed your screening. As such, all staff continue to be required to screen at the start of their shift. The screening is monitored daily and followed up as required by supervisors. Staff who repeatedly do not complete the screening may be disciplined. Secondly, COVID vaccine for staff. Overall, our confirmed COVID vaccine rate, that is those who have provided documentation of vaccination, sits at around 64%. Ideally, we would like to see an overall rate of somewhere in the neighbourhood of 70 to 75% among staff. There is some variability among different groups. For example, our frontline residential group rate is about 67%, our clinical staff rate is about 83%, and our admin and support staff rate is about 72%. Vaccination continues to be optional, but the more staff we have vaccinated, the more we can protect our supported individuals and the more we can protect each other and our families. To that end, for those who have not been vaccinated or have not provided proof of vaccination, we are introducing a mandatory vaccine education session which outlines the reasons for vaccination, how vaccines work, the safety elements of vaccines, etc. This will be rolled out to those folks over the next week or so who have not provided proof of vaccination. At the end of the session, the individual participating in the education will have to choose either to be vaccinated or to complete an attestation indicating their decision not to be vaccinated. Going through this education for those folks who have not provided proof of vaccination is mandatory. In terms of COVID vaccine for our supported individuals, by the time of our final vaccine clinic here at Ongwenada on July the 26th, we will have administered just shy of 1,500 doses of COVID vaccine to people with developmental disabilities throughout the KFLA region. This is quite an accomplishment. And I just want to thank everyone who's participated in this. It's through our advocacy and our partnership with the health unit in this region that we were one of the first regions in the province to actually vaccinate people with developmental disabilities. I want to deliver a shout out to all the staff who helped make this possible. From the staff who drove clients to vaccine appointments, to the admin support staff who checked people in and out of the vaccine clinic, to the nursing staff who prepared and administered the vaccine to the staff, to those staff who disinfected the chairs and kept everything moving, and those staff who stick-handled numerous calls and questions from families and the public at large around our vaccine clinic. A huge thanks to the parts you played in making these clinics the success that they were. And of course, a shout out to our health unit for their support throughout this initiative. In terms of opening up, with things in the community opening up, now is not the time to let our guard down. Nothing has changed in terms of PPE use, in terms of cleaning and disinfecting, physical distancing, and so forth. As more of the population gets fully vaccinated, and as things open up more, some of these may change. As we have done all along, we will keep staff apprised of any changes that are being introduced. There's still a lot of unknowns out there. All we can do is what we have done thus far. That is, follow the best advice that we've been given, follow the directions that we've been given, and it's worked well for us thus far. Now is not the time to stop. Thanks very much.